Hi, my name is Taylor Stamey. I'm a second-year medical student at the Brody School of Medicine, as well as the co-director of the Greenville Community Shelter Clinic. This summer, my co-director, Femi Opalami, and I partnered with Janet Moy from the Community Crossroads Center to lead a COVID-19 vaccination grassroots campaign entitled Vaccine Boosted. The target population of the Vaccine Boosted campaign was members of the West Greenville community. West Greenville is a low socioeconomic area located inside Pitt County, and Pitt County is ranked 48th out of the 100 counties in North Carolina for COVID-19 vaccination rates, with only 54% of the population fully vaccinated. We wanted to host our vaccine clinics at locations that members of the West Greenville community frequently visit in order to alleviate the barrier of having to find extra transportation. The locations we chose were the Community Crossroads Center and the Joy Soup Kitchen. The Community Crossroads Center is the homeless shelter located in West Greenville, and the Joy Soup Kitchen is a free soup kitchen located in West Greenville and located on a bus line. We wanted to have community ambassadors educate people on the importance of getting vaccinated. We wanted our community ambassadors to either be members of the community or people who are already embedded in the community, and so this role was filled by community members and community health workers. Our clinics were mostly hosted in the morning, but one of our clinics was hosted in the evening in order to accommodate varying schedules. The way our events would work is we would have community ambassadors positioned at the door to inform guests that we would be providing people with the COVID-19 Pfizer vaccine if they were interested. They would provide education on the importance of getting vaccinated, as well as a pamphlet in both English and Spanish. If the attendee indicated that they wanted to get vaccinated, they would be provided with a consent form and directed to our clinic. After being called back and receiving their vaccine from our med student volunteer, they would receive a $10 gift card to Walmart, a goodie bag, and flyers to give to people that they know. At the Community Crossroads Center, we were able to provide pizza to all of our event attendees, not just those who wanted to get vaccinated. At 5 events, 52 people got vaccinated. 13 people received their first vaccine, 4 received their second, and 35 people received their booster. The majority of people surveyed found the use of the community ambassadors helpful. They also indicated that the education provided at the events influenced their decision to get vaccinated, and that they plan to encourage others to get vaccinated as well. Some of the lessons that we learned is that community ambassadors need to be thoroughly vetted for professionalism and likability amongst the community, and that all aspects of the campaign need to be implemented at each event because events were more successful when we advertised and incentivized as planned. In the future, we hope to expand to include the flu vaccine because there's been initial interest in the flu vaccine, and people have indicated that they haven't been able to get their vaccine due to issues with transportation. We hope that by bringing the vaccine to the members of the community, we can increase vaccination rates. I would like to thank the Community Campus Partnerships for Health for awarding us with the NNICE grant, which allowed this campaign to be successful. I would also like to thank the Joy Soup Kitchen and the Community Crossroads Center for allowing us to host events at their location. Thanks.
All right. Hello, I'm Dr. Julius Quentin Millette, and I'm really delighted to be invited to be a part of this program, and I welcome you to the Rural Health Symposium. My talk is going to be on the project that we have in 3 counties in eastern North Carolina. It's a behavioral health and criminal justice program. It's quite unique, and I think it really will be something that hopefully will add to your armamentarium of ways of treating substance use. So why is substance treatment important? A few years ago, probably there would not be the knowledge of what substance is. And we used to say substance abuse, but we realized it could be any substance that could be abused. And then we want to make it kind of go from the moral criminal intent to more of a disease process. So we use the term substance. So why is it important? Well, obviously we know about the addiction that occurs and the things that associated with that. But there are also medical, physiologic, and anatomical issues and conditions that do occur associated with substance use or misuse. And then there's the social piece. Those of us that have seen, fortunately, not in most cities, but in most big cities, you will see homelessness and crime and violence. And most of that has been associated with drug misuse. And finally, the economic piece, which probably is on the forethought of a lot of policymakers. And they feel that this has really cost our society in healthcare, productivity, accidents, and other things related to the economy. I think in North Carolina recently, there was a number that over $4 billion was spent on a yearly basis in trying to prevent substance use disorders and overdoses. Now, in our project, we have community stakeholders. There's the Kinston Community Behavioral Health Center, the 8th District Court System, the Lenore Department of Social Services, and we've recently added another stakeholder, the House of Hope Residential Recovery Center, which is a place where folks that are in the treatment program but have detox can have safety for being able to live, being able to become educated, seek employment, and support. Our organizations that are involved is the judicial branch that includes Lenore, Greene, and Wayne counties. The Kinston Community Health Center Behavioral Health Substance Treatment Program, of which I am a part of that, and the Kinston Community Health Family Medicine and OBGYN divisions. And there we are, our 3 counties. We represent Greene, Wayne, and Lenore County. So who participates in this? Well, our patients do, obviously. Providers and law and judicial components are quite important. Now, leaderships, Dr. Harrell, Brandy Harrell, is a social work PhD, the Honorable Judge Elizabeth Heath, who's the judge for this district, and myself. Our team consists of a case manager, person who directly interacts with the court, peer support. They provide support for the activities of the patients and clients, the therapists who do the cognitive behavioral therapy and family evaluation, medical assisted therapy, which is what I do, and prescribing the medication and the overall health evaluation, and a psychiatrist, because there is a large comorbidity component to substance misuse. Our goals, we are needing to understand that because this affects lots of areas of our society, that there needs to be an integrative model in order to really treat it. So we have to identify the needs and responsibilities of the affected individuals and groups. We have to commit to communicating. Yes, I speak with sheriffs, judges, and others about our patients. And we deliver services based on the individual needs, responsibilities, and achievement as primary and long-term foci. Our patients have to commit to wanting to become substance-free, and we assist them in doing that. So how do we integrate? Well, we look for common goals, common obstacles, common strategies. We respect the individual goals, individual obstacles, and individual strategies. We also review our outcomes and review our stumbling blocks in particular so that we can make certain that we are going to make a difference. We're actually going to solve some problems. We do that, and our strategy is important to remember that we have different backgrounds and different goals, but our main strategy is to help the patients and the individuals have success. And that's where we get our rewards. Integration does not mean disintegration. It is okay to work with each other. You can still maintain your goals, you can maintain your abilities to interact, and of course, you will be rewarded in the end by having all of you work together so that we can make a difference. And I thank you for this, and I look forward to working with you and having questions.
Hi, my name is Rachel Stewart, and I'm a public health dental hygienist with the ECU School of Dental Medicine Rural School-Based Oral Health Prevention Programs. One goal of Healthy NC 2030 is to improve overall child well-being by reducing adverse childhood experiences. One way to do this is by treating and preventing dental caries. Dental caries is the most common chronic disease experienced in childhood. Dental disease can greatly affect a child's capacity to succeed and learn in the educational environment. School-based programs like ours are associated with a 40 to 60% reduction in dental decay. They can also prevent lost time from school and missed work from parents and caregivers for taking them to dental appointments. In 2018, the Duke Endowment provided a $65,000 grant for an initial 6-month planning phase. In 2019, an additional $400,000 grant was awarded for a 2-year implementation phase. Continued funding and sustainability is from revenue collected from insurance reimbursement and support from the ECU School of Dental Medicine. It's important to note that while we do file insurance and collect reimbursement from Medicaid, NC Health Choice, and private insurances, no copays or deductibles are ever collected. Parents and caregivers never receive a bill for our preventive services. We chose Bertie County because it is located in rural northeastern North Carolina, and it has a low dentist to population ratio with only one dentist for over 17,000 residents. Their socioeconomic status also impacted our choice for a school-based program because their median income is below $38,000 a year. More than 20% of their residents are currently living in poverty, and more than 90% of their school children are considered economically disadvantaged. It was also important that the program be located near a ECU clinic for additional treatment. There is an ECU Community Service Learning Center in adjacent Hertford County. Program components and patient care include oral health education and supplies for all children, regardless of enrollment in the program. All public school children are eligible as long as their parents or caregivers sign a consent form. Services include, but are not limited to, cleanings, radiographs, sealants, fluoride, silver diamine fluoride, in-person exams, and teledentistry exams. Children also receive treatment and case management and establishment of a dental home. This is some of the equipment that we use to provide services on our school-based sites. Teledentistry exams are an important part of our program. They help us to triage patient care and facilitate more efficiency in the program. Public health dental hygienists work on site to complete preventive care and collect diagnostic information. A dentist then asynchronously reviews the information off-site, looking at chart notes, radiographs, intraoral photos, and finally provides a diagnosis and recommended care plan. Sites include 4 elementary schools, a middle school, a high school, and the Bertie County Health Department. The Bertie County Health Department was added as a site during COVID-19 so that we could continue providing care while we were not able to enter the schools. Services provided since 2019 include over 8,000 procedures for more than 800 patients. More than 1,200 cleanings have been completed, over 2,000 sealants, and more than 1,300 fluoride treatments. Insurance representation includes more than 75% Medicaid or NC Health Choice patients, about 7% private insurance, and over 17% non-insured patients. It's also important to note, again, that patients, even if they're non-insured, do not receive a bill for treatment. For the future, Bertie County program will continue to work toward full sustainability, continued quality improvement, and expansion of sites and services. We have also been awarded a grant from the Duke Endowment again for a planning phase in a Jones County program, and we will soon hope to be awarded full funding to implement that program. That program will then begin working towards sustainability sometime in 2023. At this time, I'd like to thank our program director, Dr. Wanda Wright, our supervising dentist, Dr. Vanessa Party, Dr. Ford Grant, Dr. Nicole Beasley, and Dr. Michael Webb, my coworker and public health hygienist, Jennifer Buck, Dr. Otis Smallwood, the superintendent of Bertie County School District, the Duke Endowment, Bertie County Health Department, and of course, all the students, staff, and administrators of the Bertie County School District.
Hello everyone, my name is Brooke Gillespie. I am the project coordinator for the Fresh Start program, and I am a senior in the Nutrition Science Department at East Carolina University, and today I will be talking to you about Fresh Start and why it is so important. Fresh Start is a mobile telehealth and culinary medicine program that was designed to improve diabetes management and outcomes with uninsured patients within rural eastern North Carolina. So why do we prioritize the uninsured patients within eastern North Carolina? Rates of food insecurity almost double in eastern North Carolina compared to the rest of the state. And food insecurity associates with poor nutrition intake as well as reduced management of chronic diseases such as type 2 diabetes. Individuals who are diagnosed with type 2 diabetes within rural eastern North Carolina have a 50% greater chance of mortality than the rest of the nation. So to address health disparities in eastern North Carolina, Fresh Start prioritizes the vulnerable patient population, which includes uninsured, underserved, food insecure, and low-income communities. And we do so by partnering with the North Carolina Association of Free and Charitable Clinics. We are currently partnered with 4 clinics and are serving 12 counties throughout eastern North Carolina. Fresh Start was developed from previous produce prescription programs at Eastern North Carolina University, such as Farm to Clinic. Farm to Clinic's original mission was to address food insecurity by providing food to underserved patients straight from the farm right to their hands at the clinic. But in doing so, we realized that people need more than just access to healthy food. And there are 4 primary factors that affect health outcomes within individuals. The first 40% comes from socioeconomic factors that can be addressed through access to healthy food. However, Fresh Start was developed to address not only socioeconomic factors, but individuals' physical environment, health behaviors, and access to and quality of health care as well. And in doing so, we provide our patients with 3 free services when they enroll in the program. The first service that we provide our patients is one-on-one health coaching. When a patient is matched with a health coach, they are matched with a student volunteer at East Carolina University. And each student volunteer is thoroughly trained on how to provide support and encouragement to their patient, and as well as help lead their patient into these smart and sustainable goals for themselves around healthy eating and physical activity. The second service that we provide our patients are our group classes. We take the classes to them with a mobile unit, and in each class we provide nutrition education with hands-on activities, easy physical activity demonstrations that they can do themselves, and we bring culinary carts into the classes and ingredients, and we do some cooking with our patients and some taste tests. That leads me to the third service that we offer our patients. At the end of each group class, we provide them with a produce prescription. We try to match the vegetable that we cook with in each class to the vegetable that they take home. And we also provide them with recipes on how to utilize the produce that we give them. Each recipe is cost-effective, simple ingredient, and simple to follow. And we also provide them with health benefits. As Fresh Start addresses health disparities using the combination of these 3 services, we have seen a 1.87 average decline of hemoglobin A1C within the 4 months of enrolling in the program. We have also seen an increase in food literacy and physical activity and overall diet improvement. And moving forward, we do plan on expanding this as well. Thank you.
Good day. My name is Dr. Donna Robertson. I'm a professor on the ECU College of Nursing, and I, along with my team members, are happy to be presenting the Brainiac Boot Camp to you today, which was an opportunity for us to engage community dwelling seniors in activities to improve brain health. My team is Cindy Scheimer, Jean Matthews, Dr. Kimberly Delgado, and Julie Gavin. The idea came from Cindy Scheimer, who is the Director of Programming for the Pitt County Council on Aging. And she suggested that we do a series much like your childhood summer camp, with that sort of being the underlying theme. Our aims were to engage our rural community dwelling older adults, and we would tailor it to be more aligned with building those social and community relationships, increasing health literacy, and to develop health promotion behaviors. Our plan was to have a 2-hour session once a week, and we did it for 4 weeks last summer. And we brought in multidisciplinary speakers. We used a variety of learning strategies, and we made it fun. We had people get up and move around. And of course, fun equals food. So we fed them healthy food, but we fed them, and we had prizes. And like any good summer camp, the campers received a t-shirt. Our topics were varied. We brought in a renowned regional expert, well, actually international expert, to talk about nutrition for brain health. We had exercise. One of our team members, Julie Gavin, could teach Tai Chi. And we also had Tanisha Armstrong join us to do strengthening and stretching. And this was adapted for a variety of abilities. It could be from the chair, supported by a chair, or standing. We talked about sleep. We talked about healthy aging, dental health, medication safety. There was a whole day devoted to information on the North Carolina Registry for Brain Health and opportunities to learn about research on dementia. The activities included lectures with colorful handouts. We had group exercise. We played games like Brain Bingo, got very competitive. We had breakout sessions, and we ate. Our local restaurants and grocery stores provided snacks for each of the days, and it was wildly popular, as you can imagine. And what fun we had. Here is a picture of our totem pole. You know, a good summer camp has a totem pole with signs pointing the directions. And so we had that. Cindy had a wonderful intern who created this. She was very artistic and creative. And you can kind of see beside of Julie Gavin there in the right-hand picture, a campfire. Of course, we couldn't have a real fire in the building, but it was very realistic. And you see that everyone is paying attention. Looks like we're talking about the umbrella of dementia and what falls under that. And then the group was up and dancing in the bottom picture. Here is our team. So it's Julie Gavin, me, Jean Matthews, there's Tanisha Armstrong, Cindy Scheimer, and Dr. Kimberly Delgado. We had people bring in information from area vendors. And the last day we met around the campfire and we shared and we sang. And here's the whole group of our campers in their t-shirts. It was tremendous fun for us, and I think they enjoyed it as well. It was well attended. We had people started carpooling and calling each other, trying to bring them in. There was high overall satisfaction scores. People wanted more information on sleep and mental health. They probably were not going to do Tai Chi on their own, but they were interested in learning about it. Our next Brainiac Boot Camp is already scheduled for June of next year. We're going to expand to 50 campers. We're going to use the local Pitt Area Transportation Service, or PATS, to bring in people who can't drive. We already have sponsors committed. We will have scholarships for those who believe it is a financial burden to enroll for the camp. And I just would like to say thank you for your attention. If you want to help, here's my contact information. If you would like to bring a camper, you can contact the Pitt County Council on Aging. There's their telephone number. It's out on County Home Road in Greenville. And I hope that you enjoy this presentation as much as we enjoyed delivering the camp. Thank you.
Hi, my name is Chrissy Simonson, and I'm excited to have this opportunity to share with you some amazing work of my team, Healthier Lives at School and Beyond. We are a school-based telehealth program that serves students in schools in Duplin County, Jones County, and also Clinton City Schools in Sampson County. Our telehealth model is comprehensive and interdisciplinary. We are offering services to children while they're in school via telehealth, and we offer services in behavioral health, nutrition, and also acute medical care. The pandemic, as we all know, brought many challenges for all aspects of life. But our project is in its 7th year, and we thought we had already overcome our biggest challenge, and that was Hurricane Florence. Our program's first year was the 2017-2018 school year. And we had just started to get into the groove of referrals and seeing children for behavioral health and nutrition and sick visits. And then Hurricane Florence, as many of you remember, the eye of that storm was directly over Duplin County, the first county we were in. And so they were out of school for 4 to 6 weeks. So we had already done our first pivot with this program, but with amazing partners in these counties, particularly our partners, the school nurses, we were able to continue to build on this program. The children that we serve face tremendous barriers to care. Many of them live in poverty. A lot of them have transportation issues that keep them from seeking resources outside of their county or even their hometown. We have found that most of the children we're serving, a lot of them do not have health insurance, and many of them don't have a medical home or a primary care provider. So we really feel like this program is offering services to probably our most vulnerable children in Eastern North Carolina. So we were feeling pretty good prior to COVID-19. But what do you do when your school-based telehealth program is not able to get into schools? Well, ideally, we want to continue our services for our students in their homes. Telehealth, we have seen during COVID that we're able to telework and do things from home. But we quickly realized that in addition to the barriers I've already listed, our children also have another barrier in that their homes do not have internet access. So herein lies the biggest pivot thus far of our work to date. What we did, we partnered with the school nurses in the fall of 2020. All children were learning virtually in Duplin and Jones County. I'm not sure how well that was going because a lot of them didn't have internet at home. But we said to the nurses, what do we do? What do you need? Even children that were virtually learning and were not going to be in a school building in the 2020-2021 school year were still required to have a school physical health assessment on file by October 31st, or they would be kicked out of school. Kicked out of virtual school or in-person school, did not matter. As I mentioned, these kids do not have primary care providers. They don't have health insurance. So they were on the verge of being kicked out of virtual school, which felt pretty unfair and unjust. So we took our show on the road. We pivoted with the pandemic, and in 11 weeks in the fall of 2020, we went to 11 different schools in Duplin County and completed 153 health assessments for school-age children so that they would not be kicked out of school. We converted a motor coach from ECU that is normally used by the football team, but they weren't traveling to away games in the fall of 2020, into a mobile health clinic, and took our show on the road and had school nurses helping us with some of the intake and vision exams and hearing tests. I was able to take pediatric residents with me to help, and then our amazing team of health professionals, our behavioral health specialists, our dietitians, everyone pitched in and got this done. Basically, our program has continued to evolve over 7 years. We have saved over 250,000 miles of patient travel. The need for school health assessments in person has not gone away, even though things are trying to get back to normal. So we have continued to do our bus trips and have completed 7 more of these trips in 2021 and also this most recent fall. So now we've done health assessments on 255 children. And I think the biggest success is that from these in-person health assessments, we've been able to make referrals into our program for behavioral health and nutrition referrals. And the pie chart shows you the vast majority of our appointments are for behavioral health. I think we all know when COVID shut everything down, kids were going to take the brunt of this. A lot of them lost family members. They saw their moms or dads lose their job. So the mental health impacts we're still seeing. And so this program has really been able to help continue to offer that comprehensive level of care. So we've continued to grow, willing to pivot, and have continued to offer both the in-person and the telehealth services. Our original goal when we started this program 7 years ago was to keep kids in school. We wanted parents to not have to leave their job and risk losing a job to take a kid to the doctor or to go to a behavioral health visit. So kids can get that done at school. But COVID-19 and our pivot showed us that we're doing this on an even different level, and that we're keeping kids in school by completing their health assessments, which we never imagined was going to be part of our program, but has become one of the bigger pieces of it that we hope to continue in the future. Thank you very much. Look forward to discussing it more with you.
Greetings, my name is Kelly Blackman. I am actually a FNP student, DNP student at East Carolina University. I've partnered with Ms. Shannon Alley and Dr. Terry Isaac, our supervising faculty member, to develop a research project entitled Leveraging Resources to Improve Occupational Health Care for Farmers. So we came up with this idea during our research of our communities when we discovered that less than 1/4 of farm workers receive healthcare services because in the rural areas because of limited primary care providers, scarce mental health resources, a lack of health literacy, and this was really astonishing. 83% of our farmers are actually uninsured or underinsured. We wanted to target Bladen and Robeson County because those are both located in southeastern North Carolina. We also discovered in our research that farmers are one of the most underserved populations in our state. We were surprised to see that 20% of our farmers report they didn't have any knowledge of healthcare resources, where to go to receive healthcare, information regarding healthcare. So we wanted to try and mitigate some of this with developing an occupational wellness event. We partnered with some pretty key stakeholders, the North Carolina Agricultural Extension Office, which is a strategic partner, agricultural partner in each county to really serve as a collaborative arm between the federal, state, and local governments, along with the communities where they're housed. We partnered with East Carolina University and the Agricultural Medicine Department to come out and bring some resources to these farmers, and also the University of North Carolina at Pembroke, because that is a college located in Robeson County. They were able to provide some resources and a mobile medical unit for our wellness event. Our project overview is actually a pretty unique project because we've created an alternate delivery care model that's really dedicated to our agricultural workers in the rural southeastern North Carolina. Our goal really was to optimize wellness for these farmers, to really improve some healthcare behaviors as it relates to occupation, and to reduce some of those healthcare costs, because as I had mentioned earlier, 83% of our farmers are underinsured. We're the first in the market really to do this type of thing. It's an inclusive occupational wellness event that we are creating in each county. So we're going to be hosting 2 occupational wellness events. During this event, farmers can receive their mandatory pesticide training. They're able to get a medical clearance to be fit tested for respirators that are going to be required to be worn and used when they're administering those pesticides. We also will be giving them farm safety education, providing some health screenings for diabetes and hypertension, along with some mental health education. The outcomes that we're really looking at during this event is farmers' perception of how they perceive this event. Was it a helpful event? Farmers' participation is another measure that we're going to be looking at. And we're going to be surveying the farmers during the event, and then we're going to have some surveys following up at 6 and 8 weeks. This is a pretty authentic study because we are really capitalizing on our stakeholders and our agricultural experts in this field to help us. Implementation is scheduled for the early spring. In the end of January, the beginning of February, we are going to have 2 implementation dates, one in each county, Bladen County and Robeson County. We really wanted to capitalize on the downtime of farmers. This is really before their planting season starts to really get in gear. Here's a flyer for our event. This is one of the flyers that we sent out to really garner some participation. Lunch is going to be provided for our farmers during the event. It is an all-day event. Farmers don't have to stay all day, but we really do encourage them, and we're going to be offering a lot of resources for them on that day. Our data that we gathered was from the North Carolina Farmers Institute. This is a great resource with a lot of good statistics for farmers. And again, I want to thank you. I'm Kelly Blackman and my partner Shannon Alley, and we're excited to see this project come to fruition.
Hi, everyone. My name is Ren Whitfield. I'm a senior biochemistry major in the East Carolina University Honors College, and I've been working with the ECU School of Dental Medicine on the Hyde County Dental Project, which is providing oral health care in a dental professional shortage area. Hyde County is the second smallest county in North Carolina with a total population just under 5,000 residents, and currently there are no practicing dentists in the county limits, as well as the surrounding county private practices are not accepting Medicare or Medicaid benefits and are not accepting new patients in some cases. Therefore, the ECU School of Dental Medicine has created the Hyde County Dental Project in order to provide these residents with access to oral health care and to bridge the gap between their economic and geographical barriers to care. This project is meant to improve their oral and systemic health. The current clinic space is in Swan Quarter, North Carolina, and is provided by the Hyde County Health Department. The purchase of the mobile dental units, equipment, instruments, and dental supplies has been made through a grant from the Anonymous Trust, and constant collaboration has been happening between the ECU School of Dental Medicine and the surrounding healthcare agencies in Hyde County, such as the Hyde County Health Department, the Englehart Medical Center, the Ocracoke Health Center, and other community-based programs. For example, the professionals in these offices have been trained in dental examinations from the Advanced Education in General Dentistry Residency Program Director and have been given and instructed on the use of teledentistry equipment so that they can make fully informed referrals to our clinic and to provide virtual consults as needed, integrating both their primary and dental care in the county, and to properly care for the patients in an economical and timely manner. The project is currently designed as a clinic that provides oral health care using portable dental equipment, and once a month, at least 2 advanced education and general dentistry residents, 3 fourth-year dental students, 2 faculty members, 1 hygienist, and the clinic coordinator travel to Hyde County to provide care. While there, we use 4 mobile treatment units and portable chairs to perform routine, preventative, and emergency procedures on patients. Meanwhile, more complex procedures are then referred to Ross Hall in Greenville, North Carolina, to be treated because some of the advanced equipment that is needed for these procedures is not available in our Hyde County clinic. So they're referred to the appropriate clinics in Ross Hall and scheduled for future appointments as needed.
This arrangement allows students and residents to practice in a different, smaller environment, as well as see the specific challenges that the citizens in Hyde County face on a day-to-day basis. Meanwhile, the members of the Hyde County community no longer have to travel over an hour and a half to access dental care, and it provides them with care that can identify potential future issues with their oral or systemic health or both, and address current functional problems. During its 9 months of operation, the clinic has seen 129 patients in Hyde County, 1/3 of which were referred from local healthcare agencies that were mentioned previously. The providers have completed 339 total procedures, and a few patients have already completed their individual treatments after not being seen by a private practice dental professional in several years, and they will be returning to the preventative treatment moving forward. There are multiple different paths that this clinic could take for expansion in the future as the community becomes more aware of the clinic and of its oral health as a whole and how it relates to its systemic health. I'd like to say a special thank you to Dr. Rob Temple, Dr. Ed Connolly, and Dr. David McPherson, who are the other key team members on this project. And I'd also like to thank the ECU School of Dental Medicine, the Hyde County community for accepting us into their area, and the ECU Honors College for giving me this opportunity. Thank you.